Hi class. This week we're actually going to be covering Chapter 10, Mental Health Services. So I want to start by sharing with you some statistics, some mental health facts in America. These statistics are from the NAMI, or the National Alliance on Mental Illness. Their mental health facts, the data has been derived from this particular organization, which is a national organization, and there are also local chapters that offer not only the data and statistics, but programs and services and education and awareness regarding mental health. So some of the facts that I wanted to share with you today are quite alarming, to be honest, when we look at the numbers of individuals in America that are experiencing mental illness. So 43.8 million adults experience mental illness in a given year, and that equates approximately to 1 in 5 adults. And these are those that are reported. So for those individuals that are, for lack of better words, suffering in silence, those particular numbers are not being captured. So we could really look at that number and say that the incidence is even higher. 1 in 25, or 10 million adults in America, live with a serious mental illness, where it does impair their abilities to function, whether it's physically, socially, professionally. 1/2 of all chronic mental illness begins by the age of 14, and 3/4 by the age of 24. So that statistic tells me that we really need to be looking at mental illness in children and adolescents and in young adults as well, because the earlier that we can intervene and get people help and services, the more likely their chances of being able to manage and adapt later on in life. So you could see through this website, it also is shared with you in our Blackboard course shell, but you can see the prevalence of mental illness by diagnosis, the consequences and the impact that it has. So please take the time to take a look at these statistics when you have a chance. In regards to treatment, more than 60% of people with mental health problems and mental illness won't seek the help they need. So I want you to just stop this video and take a second to think about what are some of those reasons why. Maybe some of the things that you came up with were lack of health insurance, inability to pay for treatment or services, perhaps geographical barriers, maybe services, programs, or professional support is not available to them given where they might live. They might not be able to take the time to take care of themselves because they might be taking care of others. Fear is a big barrier as well as stigma. And stigma is an attitude. And unfortunately, there's been a lot of negative attitudes and stereotypes when we think about mental illness and people that are suffering from mental illness. And that stigma, that negative attitude is a huge barrier. And some people, because they're afraid of what people will think, they are afraid of what people think about mental illness. They don't want to admit, perhaps they're in denial, perhaps they're afraid. So we need to work on stopping that stigma. And that organization that I mentioned before, NAMI, the National Alliance on Mental Illness, is one organization that works to break down the stigma of mental illness so that more people can get the help that they need. Did you know that 60% of mental health professionals are clinically trained social workers? Oftentimes when we think of mental health professionals, you might think of a psychologist or a counselor, but social workers are also trained not just in mental health services, but the interventions and the resources and referrals that are necessary to help individuals that are facing mental health challenges. Clinical social work, the primary focus is the mental, emotional, and behavioral well-being of individuals, couples, families, and groups. When we are looking at an individual and their mental health, it's important to use the biopsychosocial model of health that often medical doctors, psychiatrists who are medical doctors, psychologists, counselors, social workers, they use this model so that they can get a very comprehensive and complete look into what are the factors that are contributing to this individual's mental health. So the biopsychosocial perspective looks at biological factors, maybe a genetic vulnerability or the imbalance of neurotransmitters. They also look at the psychological piece, attitudes, behaviors. They look at a person's thought patterns. And then they also look at the social perspective, which looks at, maybe one's family circumstances, peers, support. And all of these particular factors do interact. And by looking at these three perspectives together as one, we can get a much better idea and picture of not only the factors contributing to the individual's mental health, but also what can help treat them. Your textbook goes into a little bit of detail about the historical background of the mental health care system and how mental illness was understood at the time and also how it was treated. And as you can see in these pictures, the understanding of mental illness is not what it is today. And people often thought that individuals who were experiencing symptoms of mental illness were possessed by demons, they were witches, they were either tortured or they were executed, or there were holes drilled into their head to release the bad spirits or the bad blood. And unfortunately, it's these things that led to much of the stigma surrounding mental health. Your book also goes into the formation of mental health hospitals and the influence of Dorothea Dix and how she persuaded the U.S. government to fund the building of 32 state psychiatric hospitals. So you can read a little bit more about that in your textbook. And also how in the 1950s, where they started closing those psychiatric hospitals in a effort called deinstitutionalization. So they were basically releasing individuals from these institutions once the medicine, the biomedical treatment thorazine, believed to help individuals with their extreme psychiatric conditions. So you can read a little bit more about deinstitutionalization and how that impacted our current mental health care system. Once deinstitutionalization occurred, we moved more toward community-based care, outpatient treatments, where people were no longer residents, but they would receive services and engage in programs on a daily basis and as outpatients. So as we discuss in all of the chapters, the social work roles are very similar as generalist practice. You might work as a case manager and in a variety of settings, whether it is a hospital or a outpatient clinic or private practice, maybe for a government agency. You might also be an advocate trying to change policies or advocate for individuals and programs and services and grants and funding. As an administrator, and whether that's as an administrator of services or administrator overlooking, again, programs and services. And also you might be working as a direct care professional, maybe as a therapist, as a counselor. There's numerous options, and you may be doing all of the above. But there's many things, many ways that social workers play a role when it comes to mental health settings. Social work looks at treatment for mental health issues from the perspective of the recovery model. And the recovery model, again, comes from that strengths-based perspective that an individual can, and the hope is there that they will recover, versus more of a model of, I would say maybe like the medical model where, you know, it's an illness that needs to be treated. The recovery model involves the individual in the recovery and treatment process. So you could see some of the guiding principles of the recovery model here. Treatment includes a variety of evidence-based psychosocial treatment approaches. We talked a little bit about cognitive behavioral therapies and dialectical behavioral therapies, taken much from the psychological perspective. Problem-solving method, which we spoke about, where we talked about generalist practice. Assertive community treatment, which you can read more about in the textbook, as well as family therapies, various psychotherapy groups. You may have think about them like self-help groups that could be for a variety of specific issues, and e-therapy, which we're seeing, especially in the times that we are in right now, where typically e-therapy has been used in the past for individuals who may have a hard time committing to actually physically going to an appointment. And so e-therapy, maybe through a format like Zoom or Google Meet or some other avenues, allows for a client to meet with a therapist without having to, I guess, leave their home if that's an issue. But nowadays, these recent times, e-therapy is being used because of a specific current pandemic that we're faced with right now. So I just wanted to give you a little introduction to this chapter. Obviously, your book goes into much greater detail about some of the legislation and policies that have been created to support individuals that are facing mental health issues or challenges, and that protects the human rights of these individuals. Your book goes into a little bit more detail about these specific interventions and therapies, and the values and ethics that are important and that drive social work practice. So if you have any questions, please let me know. You can email me, or you can post them in the weekly questions discussion forum. I hope you enjoy this chapter and take advantage of the resources in the Week 9 Blackboard folder. There are many resources in there, as well as specific local resources regarding mental health services.